Welcome back to another episode of Questions with Crocker with me, Dr. Crocker, and my husband.
The not veterinarian.
The non-veterinarian.
It's funny, asked that if I was a veterinarian.
They did. On Instagram, you can ask just like short questions. And so they asked if you were a vet too.
I am not.
I could not see that in a million years.
Mm-mm.
I mean, there's a lot of things I could see you doing. I always felt like even though you went into finance, you could have been a detective because you love to look things up and figure things out. And I think you feel like you're secretly...
there's mill models. There's a lot of stuff I could have done.
That was at the top of my list too. That was the next one that I was going to say.
Tom Cruise
was male models. Tom Cruise needs a body double.
Could have been in risky business.
Shane Crocker, call him up.
That's right.
He's got a lot of skills. You never know. Speaking of skills, the podcast has not failed yet. So apparently we have a little bit of skill in this. It's fun talking to you, which I've been doing for 17 years, so it's not that difficult to do. But we are enjoying your all's feedback on wherever you listen to your podcasts. Things that they've been saying about you being funny, which is annoying because, yes, you are. And I think I'm funny too, but I'm not as quick as you and I'm not as dry as you. So a little frustrating that you're the breakout star of Questions with Crocker, but I guess I can handle it. But we're getting a lot of reviews and they're great reviews. And so we appreciate you guys listening. If you can share on whatever platform you're listening on and keep sending those questions. We need you to make sure that you visit our social media pages, Questions with Crocker. Message us things that you think of. If you're listening to an episode and you want us to expand on something, that would be great. We are here to talk all about just being a veterinarian, about working together and owning a practice together, about having kids in this crazy veterinary life that we live. And then I obviously am an emergency veterinarian also. And so I work for Veterinary Emergency Group, which we're going to talk about a little bit today with one of the most common questions that is very controversial that I get on social media. So before we do that, how are you doing?
I'm good.
You feeling good?
A little okay.
You've been sick. You've been sick. Yeah. I appreciate you rallying from your cold to be here with me.
It's much more than a cold.
You didn't have a fever. So technically...
Listen, I didn't get tested for stuff, but there's some stuff I got tested for.
There's things. There's like viruses and bugs that it could have been. I agree.
My Diet Mountain Dew is killing it, though.
I cannot with the Diet Mountain Dew. If anyone has any great literature or research on how bad Diet Mountain Dew is for you, send it my way, please. Because this man will not listen to me about it. But I don't listen to you about coffee and caffeine intake or sleeping. Sleeping's important too. So it's probably actually worse to not sleep enough versus drinking Diet Mountain Dew.
Agreed.
On average, what do you think that I sleep?
4 hours, 5 hours?
Yeah, it's about 5 right now because I've been working overnights in the ER and anytime
I only sleep 4 or 5 hours too, let's be honest.
Oh, your life is hard. You mean because I'm not there?
Yes.
No.
And when you are there, you're up and I'm up.
Mm-hmm.
This is not good for my health.
You know, like when I was pregnant and then you would come home and I had been working all day in the heat, pregnant, and then you come home and tell me how tired you were from your cush office job with an air conditioner. This is one of those moments where I'm just going to I'm giving you the signal to just stop. Because working 14 hours in the ER is not equal to you not sleeping as well in our bed at night.
I'm just saying.
Okay. All right.
I had my little sleep watch on, tracking my sleep.
We'll discuss this a little bit more later. It is not healthy to not sleep very much. So I'm actually looking into, one, I'm going to the doctor because I haven't had a checkup in forever and just get a couple things checked, make sure that the lack of sleep is just me not taking care of myself and not the fact that I have so much going on and maybe have other things out of whack with me. So I'm trying to, be healthy. It's weird because I tell, pet owners all the time, you need to bring your pet in. We want to catch things early. Prevention is best. And then I have not been to the doctor.
Such a good patient.
I am a horrible patient. So it's I have just enough knowledge to be dangerous. So I don't take care of myself like I should probably. But anyways, if anyone has tips and tricks for sleeping, that'd be great. Send them my way. I would love that. A little bit of housekeeping. So Shane and I have been very busy. We have plans for renovations on the hospital. So that is coming up. And we have a trip to the beach soon, which is exciting. And then I'm really trying hard. I know this is probably a pipe dream, but I really want to, at one of the conferences coming up, to actually try to have like a podcast booth at the conference. Does that sound crazy?
Yes.
Like not even a glimmer of hope in that response.
Yes.
I looked online. You can buy like booths that you can put up and they're soundproof and like 3 people can sit in them and you can podcast. And I think that would be great. If you guys want me to podcast live from a conference and you want to be a guest, just let me know. Speaking of guest.
If anybody wants to come handle the logistics around how to make this happen, feel free to.
I have a person for that. I already have somebody. Don't worry. Okay. Don't worry. But speaking of guests, we actually, even though I love talking to you, my goal is to actually have some guests on eventually. So I used to do a really popular series on Instagram where I would interview specialists and talk to them about why they wanted to go into the specialty they went into and what that looked like. And so what their path was and kind of tricks and tips for people who want to pursue stuff. So eventually we are going to facilitate that. And then I also thought it would be fun because we're a couple if we interviewed other couples in veterinary medicine.
I thought you were going on the path of, hey, we're going to let you go. It's just not quite working out. That's where I thought this was going.
No, you're not getting fired. Yeah, no, you're not getting fired at all. I still want you to be a part of things. And I actually want you to meet some of my friends that are other couples in veterinary medicine that are great, like the calf vet and the derm vet and all these people on social media that I absolutely adore. So I'm hoping that you will be a part of that. Will you continue this journey with me, Shane Crocker? He nodded yes. For those of you not watching on YouTube, you can watch us on YouTube. He nodded yes. So
I have a lot more facial expressions on YouTube.
we will continue this journey together. So today I did want to do a this or that with you. And I already know the answer to all these, but I thought I would ask you anyways. So we're going to do a food this or that. Okay.
Steak.
It's not like that. Oh. Okay. So this or that, Italian food or Asian food?
Italian.
This or that, Mexican food or Asian food?
Mexican.
This or that, American food or Asian food?
American.
This or that, Japanese food or Chinese food?
I took 2 years of Japanese in high school.
I can
count to 5. I can say good morning, teacher, and I can say I don't understand.
Let me hear it. You said
Ichi ni san chi go. That's 5. Wakaramasan. That means I don't understand. With a southern accent.
I was going to say, I feel like the accent just kills all these things.
Ohayou gozaimasu sensei.
Did you pass this class?
I don't know. I guess.
I guess this is when you're an athlete and they probably just had to pass you.
I remember it was telemedicine. It was a complete cluster.
I used to
2 years of
dislike people like you that just walk through class because you were an athlete in school. That's all right. You turned out okay. Don't give up on those athletes. So if anybody
speaks Japanese, please confirm that what I said was
inaccurate and horrible. Yes. You horribly did that probably. It has been since high school, so I guess we'll give you a little bit of grace.
That was a long time ago.
But the point being that literally you would choose any other food over Asian food, and my favorite food is Asian food.
But I eat a lot of Asian food.
You do. We were married 2 years before you told me that you didn't actually like sushi that much. But we go eat sushi all the time.
I like it a lot more now.
Okay. I'm glad.
I did.
I'm glad. If this kid comes in here right now, what, sir?
I can't hear you like I can't sleep.
Okay.
I can hear you all the way through the door.
We apologize. You can hear us through 2 doors. However, try really hard to go to sleep and we'll try to be quiet. Love you. Good night.
I love you.
Yes, that's our 7-year-old awake.
Surely Harrison's going to cut that out.
10:40 at night.
Yeah.
Sorry, Harrison. Okay, so at least you love me enough to still eat Asian food. And honestly, I don't love Mexican food that much. And I still go to that with you.
That's so un-American.
It's not un-American. It's just not my favorite. Sorry.
Chips, salsa, margaritas. Where can you go wrong?
chips and salsa margaritas are not Mexican food.
Yes, that's quintessential.
Anyone who wants to weigh in on this, like, is that what Mexican food is, or is it all the other things? Because I don't feel like that. That's like an appetizer and a drink. Okay. I'm over this discussion right now. So moving on to our question. This is a question I get
What are we talking about?
a lot of comments about and a lot of controversy because VetMed gets real fired up when I bring up this subject. But if you know anything about the ER group that I work for, Veterinary Emergency Group, we are an open concept ER. So can you explain what that is, Shane Crocker?
Yeah, you walk in and it's everybody in a one big room together. Patients, clients, technicians, doctors, everybody.
Everybody. It's probably your nightmare, right?
Yeah, it's chaotic.
So that is what a lot of people say.
But I do see the value in it.
I appreciate that. And we're going to get into the value of it. So basically, I mean, honestly, at this point, it's kind of funny, but I will post something about working in the open concept ER. I'll show an owner of like a pet owner that's getting to sit with their pet while they get fluids, or I'll just talk about the efficiency and the value of it and how much I love my team and like what we're doing together and doing things so differently, which veterinary medicine needs different at this point in time. And literally people in the comments on social media will say, well, that doesn't work. That's horrible. That's my nightmare. Well, that'll never work. And it is honestly a little infuriating because one, the company's been around for 10 years and we have 50 locations. So something is working. If it wasn't working, we wouldn't be growing like we're growing, right? And two, we constantly get feedback from pet owners that is positive feedback. And if you work in veterinary medicine right now, that doesn't happen that much. You constantly are seeing people complain about, their veterinarian, complain about their experience. You're hearing people in our industry complain about the way that clients are treating them. So to pull back the curtain, be transparent about what we're doing, how hard we're working, and have people see that and respond to it is really valuable. But I don't know if there's anything in your industry that changed where people said, oh, well, that'll never work. And now it's like a huge thing. But it's just frustrating that they won't even consider it and think that, oh, maybe doing things different is not the worst thing ever.
Yeah, I mean, there's a lot of things that are constantly changing and people say will never work without really giving it the time of day. I mean, when we were in healthcare technology, some of the stuff we were doing with analytics and trying to predict those patients that need more intervention. A lot of people would say, hey, that's never going to work, but the data will tell you otherwise. So I think there's definitely industry things that change and become, a new for the industry that people just automatically assume won't work.
Well, and the thing that adds to it is most of these people have never even been in one of the hospitals before. So it'd be different, right? If they went and they experienced it and they're like, ugh, like I didn't like it or it didn't work.
Yeah, I think what people maybe should say instead of saying it won't work is that it won't work for me.
Right.
As a veterinarian or as a technician, this isn't something that'll work for me.
And my response to that is, that's great. Like, we don't need everybody to work. And not everyone in general wants to work emergency medicine. That is a whole beast in itself, right? But for certain personalities and certain people, depending on how you want to work and also how you want to be paid and valued in this industry, it works really, really well. And so I wanted to make an episode about it, answering the most common questions that I get about it and kind of the things that people say about why it won't work. But I want to preface all this with, I do not want everyone to come work in the open concept ER, but I do want people to respect the fact that we all have a place in this industry and someone else might work somewhere that I'm like, ugh, I would never want to work there. But I'm not going to go on social media and try to like put them on blast over it. Like that choice is yours if that's where you want to work and how you want to practice. This choice is mine. I'm not saying anyone else has to do this. I'm saying I really like it. And I think that it has given me a new excitement for our industry and the fact that we're doing something so different and that pet owners are responding to it. And if people could see that and try to understand why do pet owners like it? Why are they getting good feedback? Why are they getting doctors and technicians to go and work there? What is it that is making it seem enticing and keeping people there, then that is the conversation, right? But it's not just, oh, it won't work. I think that is such a short-sighted thing. And obviously it frustrates me. But I can't usually talk about that on social media. So I'm glad I have a podcast finally where I can share it a little bit more. So a couple of things that people say about why it doesn't work. And I think you would totally get this and respond to this. A lot of people say an open concept ER where essentially our doctor island where our computers are is in the center of the treatment area. So I can see everything going on. But they say being constantly on display where pet owners are constantly looking at you and they can see you and honestly they can just walk up and talk to you is exhausting.
I can see that. Yeah, I can see where it's definitely exhausting.
You're an introvert.
Yeah.
Like that could be something that would just suck the energy out of you. So the surprising thing is a majority of people in veterinary medicine are introverts. That's been shown over and over in studies, but that doesn't mean they're not great with people like one-on-one. And I think people think of the open concept as just being this like very loud, chaotic space. And sometimes it is. Obviously, there's rushes and there's things going on. But a lot of times we are like one-on-one with clients and we're talking to them and their pets right there. And it's very intentional, the communication. And so I don't necessarily feel drained from it. We do allow space and time for people to go and get away. There's a break room that they can go to. People will step outside if they need to. So it's not like you have to be there if you like really need a mental break. But I think most of us find that being accessible and having a team that's accessible to owners helps with communication, helps show the value of what we're doing. And I don't ever feel like I'm on display. The other thing people say about being with pet owners is they feel like they can't be themselves. So if they cuss sometimes, or if they, like to be loud or tell stories, they feel like they can't do that in that setting. And I would just say that's not true. There's many of us that are very straightforward. We're very authentic to who we are. And no, I'm not yelling and screaming cuss words in the middle of the room, but I have said to an owner, and this is just a warning for anyone listening with children in their car, but I've said, this is a really shitty situation. Or I've said like what I need to say, and I don't sugarcoat things because I'm in an open area.
But you would have that same conversation if it was one-on-one in a room,
100%, 100%, because part of the job of an emergency vet is to connect with people and to be real and to be on a team with them for their pet's healthcare. And if you're always trying to like act professional and like not really be yourself and not show you really care and not show your, worry about things, then it's not going to work. Like you're going to burn out if you can't just be yourself. And so I think it's funny when people say, well, I couldn't do it because I cuss so much, because if you knew our team, there's definitely some things that are said that are interesting, but we're people. And I think being in the open concept ER, people see that we are just human beings that are working our butts off for their pets, and they respect that and they value that. And they don't really care if occasionally we say something that you might consider unprofessional or inappropriate. The other thing is CPR. So in a traditional emergency room, like let's say you and I had a dog at home that collapsed, and we pick our dog up, get in the car, we're freaking out, we call the emergency room, we're headed that way, we run in with our dog. They would take our dog, we would be in the lobby, and they would take it to the back, is what they say, right? And then we would just sit there for however long, not knowing what's happening with our pet, not knowing if they're alive, if they're dead, if they're doing CPR. Maybe someone would eventually come out and say, they're not breathing, we need to do CPR. Are you okay with that? It's going to be, $400. And we would say, yes, do whatever. And then they would run back. And then we're sitting there and we're waiting and we don't know what's happening with our pet. And in the past, when I've dealt with that traditional model, people get frustrated because they're worried about their pet. And even if something is 5 minutes, it feels like forever when you are worried that your pet is dying and you can't see them. So part of the value of the open concept is if someone rushes in, they put their pet on the table and we assess them. And if we need to start CPR, the owner's right there and we say, there's no heartbeat. Can we start this? Yes. We start CPR. I'm actually not doing CPR as the doctor. My team is, and I'm explaining to the owner, what we're doing, why we're doing it, what findings we're getting. My team is telling me and giving me readings, blood work readings, and, whether they're getting a heartbeat or not. And we're placing a catheter and we're giving atropine and epinephrine and we're checking like the ECG. But the whole time I'm with the owner and I'm talking to them about what they're doing. And a lot of people say that would be horrible.
Do you ever have clients that don't want to be there, that say, I can't deal with this, come tell me what's going on?
I think in a year and a half, I've had 3. And we do have, so the doors are open between like kind of the waiting area, the initial entryway, and the treatment room. So if they need to step away, they can, right? But if they want to stay and they want to see what's happening, they can do that also. So they have the option.
What about that happens and you have 2 other cases in there and other owners are like, at a table beside you or whatever? What happens then?
So a lot of times, that's a great question. A lot of times those owners will like respectfully just kind of move up to the lobby area, or they'll just move a little bit further away. On the flip side, and these are the moments that make me see the value of what we're doing, we've had owners with other dogs in there that have come over and comforted someone. And to see like a community created where someone is seeing their pet and worried about their pet, and other pet owners are recognizing that and coming over and like giving them a hug or giving them a tissue, like it makes me emotional, because that is what we're trying to create. We're trying to create those moments where it's people who love pets and people who are there because they're worried about their pets and they see each other and they feel for each other and they're empathetic to each other. And that happens a lot more than you would think. And so it creates this feeling of we're in this together and we're just hoping that the pet makes it. And sometimes they do and sometimes they don't. But if they don't make it, they've seen how hard we worked for them. And we get that comment all the time from owners saying, I never understood what CPR was. I did not understand how much you guys did. Like now I see what you're doing, why it costs money, what you're doing, how many people, 5 people were just working on my dog at one time. And they understand.
Are there any like in human medicine, you have like HIPAA laws and stuff like that? Is there anything like that with pets?
So there's not HIPAA. There is, in some states, there is a like vet-client relationship where you're not supposed to share information, meaning if we diagnosed a pet with something, like let's say they came in and the pet was like cocaine positive or something, like that wouldn't be something we would share with another owner in the building. But there's not a HIPAA law where they can't see. And if you think about it, there's actually been some studies that have shown in pediatric wards that it is better to keep family members with their children when their children are critical. And if worst case scenario, something happens, them being a part of that and seeing what happens and being along for the process actually helps them with understanding. And so I think that that's kind of the research that has shown us that pet owners being there, seeing how hard we tried, and really we tell them like, you did everything right, you brought them in. I think that gives them a little bit of closure in like a really tough moment versus coming out of a hall, you've been standing there for 5 minutes, not knowing what's happening and saying, sorry, like they died. Really sorry. We tried our best. Here's your bill. And that's the reality of the difference between the two. And that is why pet owners get upset. And it's because they don't know what's happening. So the transparency of the open concept in that moment is really, really valuable. Now, the other thing is that people always ask about aggressive pets, which makes sense, right? Like if you have aggressive pets, if you have pets that don't do well with other dogs or people, that is hard in an open concept where they can't get away from them. And so I always tell people there's rooms. There's also rooms for scared cats. We have exam rooms. So people, again, have the option to go in a room if they need to. And most people with like truly people aggressive pets or dog aggressive dogs, they call us and they say, hey, I need to come in. This is what's happening. This is my dog. And, they're aggressive. And we have a back door we can bring them in and we take them right into a room. And so it's not something where they have to be in that big open room and be uncomfortable with everybody. Cats are the same way. Cats don't react well to a lot of dogs and loud dogs. So we have an area that we take them into. lot of the newer hospitals have actually built cat areas that are open and cat wards. And so that is good because they're able to get away and do their own thing. So we've thought about these things.
What about surgery? Do you do surgery out in the open?
So not in the open room, but we have a surgery suite because of the fact that it has to be sterile. And so we have a surgery suite. And again, people have the option to watch. Now, the good thing about watching is if something happens, so if I'm in the middle of a surgery and we're not really sure what we're getting into, and I get in there and I say, oh no, it's not just a tumor on the spleen, there's also a tumor on the liver, which has happened to me before. The owner is there and I can say, look at what I found. What do you want me to do? Do you want me to proceed? Do you not? We can talk through it. And there's no trying to reach him on the phone. There's no trying to figure it out while this critical pet is like under anesthesia, right? I was worried about the battery, sorry. And the other thing is that if they don't want to be there, they don't have to be there. But a lot of times people do because sometimes that's the last time they're going to see their pet. And them seeing their pet and seeing what happens, and again, giving them a chance really helps them if things don't go well. So we definitely do. People can watch x-ray through a little window so they can see, their pet getting x-rayed. We have an ultrasound on the floor. We're pulling the ultrasound out for everything. We're ultrasounding. So as I'm going through it and I'm showing people, like, I'm doing my exam, I'm talking through it, I'm grabbing the ultrasound, I'm saying, oh, look at that fluid. I'm worried about A, B, and C. I take a sample of the fluid right in front of them. All that is happening right in front of them. So by the time I get to your dog has a bleeding tumor in its belly, we need to do surgery, this is why, this is the cost, I don't have to go through like, this is what I found on my exam, this is what I ultrasounded. Like all that's happened in front of them and they've processed it and followed me along the way. And so the efficiency, I think, is much better. A lot of people feel like for some reason the owner's being there is less efficient. But to me, going back and forth to a room and relaying communication instead of just having them be present for things is really valuable.
I can see that. I could also see like the value of, let's say you have 4 patients in there at the same time. You have to triage that and figure out which one's more, important.
Mm-hmm.
And I could see being a patient sitting in there saying, you need to handle that dog before you come to me, and it being okay. But if I'm stuck in a room for 30 minutes saying what's going on,
Yeah, that's one of the biggest complaints is wait times at the emergency room, like people and like animals. Yeah. So 100%, we will have people, and I'll go up front sometimes and say, hey, I'm Dr. Crocker, like 3 of you just got here. We're going to get to you as soon as we can. Like the technicians will triage them. So we know that people, like, they're stable. But a lot of times if there's something critical, like on the table and we're working on a dog, people will be like, no, you're fine. Like, obviously that dog needs us more. And so I don't get complaints about wait times unless we're slow. And then people are sitting there and we might have like hospitalized ones that are critical and they can't see what exactly we're doing. So that's, where it starts to come into play. But when we're a busy emergency room, they see it and they understand much more.
What about checking out, like financial checkout? Is that done there in the open room too?
So we do have a receptionist area where, yes, they can, but we do a lot of electronic text message and emails for checking out and for things. And so a lot of times they don't have to go up front. Now, the interesting thing is emergency work is not cheap, right? 24/7, like we have all the bells and whistles and we have a really amazing staff that's paid really well. So one of the other amazing things that we'll see with the checking out is if people can't pay or if we're giving estimates and people are trying to come up with funds, we've had pet owners offer to help pay for bills for each other. And that, again, is not something that would happen in a traditional ER where everyone's in their own room. And so having people connect in that way, and they don't tell people, like what they'll say is, you guys did a great job. I know that person over there was trying to come up with funds to unblock their cat. Can I donate to their bill? Like, you don't have to tell them. And so we'll have people do that all the time. And that is really amazing to see. And ultimately, it makes me remember that people are good in the world. You just have to give them a chance to be good. But when you put up roadblocks like in stressful situations, putting them in rooms, taking them away from their pet when they're worried about them, I think that's where people get frustrated, and it's understandable. So I don't think everyone should work in an open concept ER. but I think they need to realize why so many of us like it and think a little bit more about their workflow and what are the things that get pet owners angry and get pet owners upset. And is there anything you can do to mitigate some of that? And if you can, why would you not try something different?
Makes sense to me.
I appreciate that.
Yes.
I mean, I know you don't want to work in an ER,
No.
but it's obviously something
Closed off ER, traditional ER, whatever you call them, open concept ER, not for me.
not happening.
No.
This is obviously something that I am passionate about, and I hope that people will just either visit a veg near them, a veterinary emergency group location. We're open. We're always happy to have people come. If they ever want to reach out to me with more questions, always happy to answer them. It is not perfect. Nothing is perfect, but it is something different, and it's something that is needed in veterinary medicine and especially emergency vet med.
And I've heard you say that several times, like, come check it out.
Yes.
It may be for you. It may not be for you.
Right.
But you have to at least look at it, see it, feel it, touch it, try it out. If it works, great. If not, so be it. It's not for everybody.
Yeah. I think that is important. And there's a place for everybody in veterinary medicine. You just have to find it. So I'm glad I found my place, and I'm glad I found where I really like to work. Even though I do own a hospital, in the ER, it just really...
Are we doing an open concept general practice?
That's for a future episode, but yes, absolutely. That's going to be a part of our flow. Not completely open because of the way our building's set up, but I can't wait to share all the things I have planned. So you know some of them. I don't think you know the price tag, but you know some of them.
No. I know the ideas, but we'll see about the execution of.
Yeah. Thank you guys so much for listening. If you have more questions about the Open Concept ER or just anything in general, let us know. You can follow us on @Questions with Crocker on any of the social media channels and send us any additional thoughts that you have. We'd be happy to listen to them. Thanks and have a great day.